Hi, today we will be performing a head-to-toe examination. I have washed my hands, introduced myself to the patient. We're going to go ahead and start with eyes. I want to inspect your sclera are white, your iris are rounded. There's no redness or swelling of the conjunctival sacs. I just want to go ahead and look down. Okay, look up while I do this. All right, and then go ahead, look down. All right, so also there are no white opacities seen. From there, we're going to go ahead and test the optic nerve. I want to go ahead and just test the pupil constriction. So I'm going to turn on my light here. And then with my chart, okay, go ahead, look straight ahead, no, straight behind me. I'm going to shine light in your eye. Okay, and same here. I'd like to try this one more time. Okay, pupils are at a 5 and they constrict to a 3. That is bilateral. There is, it's consensual constriction and dilation. And now I want to go ahead and just do our 6 cardinal signs of direction, testing the optic nerve number 3, trochlear 4, and then the abducens 6. So we're going to do our 6 signs, cardinal signs of vision. So you're going to follow my finger. Okay, and then I'm going to point my finger in, follow it, follow it, follow it, and then pulling it out one more time, in and out. Okay, so for the eye examination, there was no nystagmatism noted. Then also the convergence following the finger in and out was equal for the accommodation test. And then, so from there, we're going to go ahead and turn on the ophthalmoscope. We're going to check out the retina and the optic disc. I'm going to put my pen light at 0. And then we're going to come in on the right side with my right arm from a 15-degree angle. And I'd also like to shut off the lights here 1 second. Okay. And go ahead, look straight ahead. Okay, and then I'm going to do the same on the left side, coming in with my left arm from a 15-degree angle. Okay, you can look straight ahead at me. Okay, great. And I just want to say that there was light reflection. The optic disc, there was no bulging. The retina, you could see near the artery and vein where there's 3-to-1 pattern, and then it was a yellowish hue. And then from there, we're going to go ahead and we're going to inspect the face. There was also no papular edema noted. And then so I'm going to go ahead and turn back on the lights and we'll start with head. Okay, so I'm going to inspect his hair. I just want to make sure there's no dandruffs, no abnormal thinning patches noted. His head is normal cephalic, no, it's atraumatic, no lesions or bumps. Here is coarse, there is even thinning noted, no infestations. And then from there, we're going to go ahead and begin our facial examination. I want to check the the trigeminal nerve for your sensory. So I'm going to go ahead and I want to tell me if you feel this. Mm-hmm. Okay. Okay, and then look straight at me. I just want to check your eye. Okay, so we have a corneal reflex. He could feel the facial, maxillary, and mandibulary branches with the pinprick test. And then from there, I would like to do the trigeminal motor response. So I'm going to feel here. Go ahead, clench your teeth. Okay, the masseter muscles are working appropriately. And then we will go ahead and check the facial nerve. If you want to go ahead and smile, frown, puff out your cheeks. Can you raise your eyebrows? Okay, and then stick out your tongue. Okay, so there's no signs or symptoms of a stroke. His face is symmetrical. There was no deviation. And then we're also going to go ahead and check the frontal sinuses. I just want to check your... Do you have any pain here?
Mm-hmm.
Any pain here?
Nope.
Okay, so that's going to be your frontal and your sinus, maxillary sinuses, checking for any tenderness, which is negative. And then we're going to do the olfactory nerve 1. We're going to test his smelling sensation. We're going to pretend like I have some alcohol here. Go ahead, close your eyes. Plug one nostril for me. And can you smell this?
Mm-hmm.
What does it smell like?
Alcohol.
Perfect. Okay, close your eyes. And we're going to do it again in this nostril. Can you smell that?
Yep. Okay,
great. So olfactory tract is intact. Next, we're going to look into his nasal passages. I'm going to get my nose scope going here. Actually, ear. Go ahead, look up. Nope, just your nose. Okay. Okay. And then go ahead and sniff. Okay. And same on this side. Okay. So there's no masses, lesions. His nasal septum is intact. And then from there, we're going to go ahead. We're going to check the acoustic nerve, which is 8. So can you hear this?
Mm-hmm.
Is it equal?
Yep, equal.
Okay, so then we're going to go ahead and inspect the ear. I want to start pulling on the targus. Any pain here?
Nope.
Posteriorly, the mastoid bone. Any pain there?
Nope.
Okay, we're going to tug on your auricle. All right, so it does not appear that there's any tenderness that would be associated with an ear infection, but we'll go ahead and we'll visualize interiorly. So pulling up and out, I'm going to put my scope in downwards to a posterior angle, looking for that tympanic membrane. And I do see it, and it is, I do see my cone of light. It is pearly gray colored, no redness or tenderness. And you can see the malleus in the ear canal. It has no wax. No masses or lumps or bumps were visualized, so that tympanic membrane did not look inflamed. And then I would like to go ahead and check the oral cavity. If you want to look at me, just looking at the lips, they are moist and pink. If you want to go ahead and open up, say ah. I want to look at the gums, they are pink. Okay. And there are no untreated dental caries. He does not have any infection or abscess. And then I'd like to look even further. Okay, stick your tongue out and down, out and down. I want to look at the back of your throat and say ah. Okay, and so that soft palate, the uvula, it does move up and down when the patient says ah. The tonsil did not seem enlarged. So that would be your vagus nerve number 10. And then also, if you can stick out your tongue. Okay, it is midline. Can you turn it from side to side? Okay. Okay, no masses or bumps under there. And then, so that would be your hypoglossal nerve number 12. And then I would still like to test number 9, your glossopharyngeal nerve for your gag reflex. I'm not going to really do it, but we'll pretend. Go ahead, stick out your tongue and say ah. Okay, and gag. Oh, good. That is intact. And then, so we would like to check the accessory nerve, which is 11. So I'm going to put my hands on your shoulder. Go ahead, lift your shoulders up, okay, and push down. Perfect. And then touch each side. Yep. Good. So that nerve is intact. And then from there, I want to go ahead and do my lymph node assessment on the neck and move down to trachea and thyroid. So we're going to start with our pre-auricle lymph nodes, post-auricle lymph nodes. We're going to do our deep cervical. And then you can do your anterior and posterior chain. We're going to feel submental, submandibular, and then your tonsillars, okay? So there were no inflamed lymph nodes, and then you can also do your supraclavicular ones. And then, so I just want to note that the trachea is midline. We're going to find that first notch there, and then we're going to palpate the thyroid gland. It does not feel enlarged, and then I can feel that isthmus wrap around anteriorly, wrap around that trachea. So from there, that would be our head to toe portion of the head completed. And then also, so we can go right into chest and lungs. And I want to just check the anterior thorax for symmetry. Okay, go ahead, take a big deep breath in. Okay, and breathe. Anteriorly, it's symmetrical. I want to check your anterior lateral. So for his chest, it is not barreled. It is a 2-to-1 ratio. And then from there, we will go ahead and check posteriorly. So you'll just go ahead and rotate your chair there. I don't know if you can sit on the side of your chair maybe, so the video can, nope, I need to see your back. Yep. Okay, so then same thing, go ahead, breathe in, breathe out. And then so his posterior thorax is symmetrical. Looking at skin, there's no lumps or bumps. And then so from there, we can go ahead and check his chest expansion. Go ahead, tilt your head down. Okay, so I want to find C7 and then count down the lumbar spine. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So here would be T12 at the posterior thorax. And then I want to go ahead and just percuss this area for any tenderness, CVA, that would be associated with any pyelonephritis. Do you feel any of that? Okay.
I feel it, but
it's not painful. Okay. And then I'm going to go ahead and percuss the different areas of the thorax for any dullness or any epiphalangy. Okay, I don't hear anything loud or dull, no, so that would suggest no pneumonia or fluid collection. And then I'm going to go ahead and listen to breath sounds posteriorly. You take a big deep breath in, blow out. Another big breath in, good, and blow out. Blow out. Again. Blow out. Okay, again. Blow out. And again. And blow out. Okay, now this time I'd like to do it and have him say E while I'm doing this. So just keep saying E.
E. E. E. E.
Okay, great. Okay, so there was no disruption in that vibration sound, nothing interfering with the vibrations. And then from there, I would like to go ahead and have the patient look forward. If you want to look at me, just one more thing I did not do. I want to just count respiration rates. I'll watch for the chest rise and fall. Just breathe normal for a minute. Okay, so his respiratory rate is 15 breaths per minute. The lungs are symmetrical. There's no retractions, no difficulty breathing, no wheezing or coughing was noted. And then from there, I'm going to go ahead and assess our cardiovascular system. We'll start with the heart. I'm going to listen to the different the different heart sounds. We're going to start on the left side at the sternal border. We will listen to the aortic valve. Then we will go to the right side. I said that wrong. At the mid-clavicular line on the right side at the sternal border, we'll listen to the aortic valve. Then we will move to the left sternal border at the mid-clavicular line. Not mid-clavicular line, but second intercostal, we'll listen to the pulmonic valve. We'll go down from the second intercostal space to the fifth. We'll listen to tricuspid. Then we'll move to the mid-clavicular line on the left side and listen to the left ventricle and the mitral valve. So we'll start here. So finding the sternum, here we can count one, and that would be our second intercostal space on the right side at the sternum. Okay, and S1 and S2 are heard. I did not hear any murmurs, and then we'll move on directly over to that pulmonic valve. Okay, and then going down to that fifth intercostal space, to the tricuspid. Okay, and S1, S2 are heard. There's no additional beats. And then we're going to come on over to Erb's point. And then on over to the PMI. Okay, and S1, S2 are heard, no additional. Okay, and I just want to feel that point of maximum impulse where the left ventricle is ejecting. And you can feel that slight bulge. Okay, and then I'm going to go ahead and check our heart rate, listening at the PMI. Okay, and I would like to say that the heart rate is 65 beats per minute, regular rate, no abnormal beats. And then from there, I would just like to go back and we're going to listen with the bell of our stethoscope and those same spots for any high pitches. Okay, and then we're identified. So that's going to be the end of this, and then we'll pick back up with abdomen and MSK. Thank you.